want to talk about Victoria Area Health Foundation. We're hosting this interview section, and we're here live with Mike Clara. She's here to share her experiences with us. She was diagnosed of a kidney disease. She had a transplant, so she's going to share with us everything that transpired, her experiences, and everything she went through during this period. And like she said, she's still in her 20s. So this shows us that someone even at that age range can still have kidney issues. But if my Clara can go through it and come out strong, we too can. Every other person affected in one way or the other can always scale through. So moving forward to the questions for today, I would like to ask basically, what disease were you diagnosed of?
Kidney failure. Was it end-stage kidney disease failure? Can you hear me?
Yeah, I can hear you now.
Okay.
Okay, can you say that again?
I was diagnosed of end-stage kidney disease, kidney failure.
Wow.
Yeah.
So do you have any idea about you to diet? Like, what do you think would have?
Sorry, I can't hear you.
Sorry about that.
Sorry, I can't hear you. I didn't get a question. Yeah.
All right, I said, do you have any idea what would have caused it?
Honestly, I don't know, because it just started like a normal malaria and typhoid. We kept treating it. At first, it started with blindness of sight. So we kept treating malaria and typhoid, thinking the sight was maybe the malaria issue causing it. Along the line, I was like, I just told my dad that I can't feel myself again, that I've literally not seen anymore. Like, I don't see what is in front of me. It got to that stage, I don't see what is in front of me. We kept treating malaria, treating, it wasn't going. I was getting weaker and weaker. So one fateful morning during the lockdown period, my dad, I just called my dad, was in my auntie's house. That night we couldn't sleep because I wasn't breathing anymore. I was breathing so fast. I actually thought I was going to die that day. I was only praying that I'm not going to die. I was just giving myself that hope that I'm not going to die. When we got to the hospital, they told me that my BP was high. And before went to the hospital, the case got to the hospital, we went to see a family doctor, and he was like, my BP is high. I was like, BP? It's not like small girl like me having BP. It's not possible. That's it's not up to, I'm not up to the age of BP. That BP is for the older people. That was the idea I was having already. So apart from that, I couldn't believe that, so that my BP could be rising to 149 over 130 something. And my dad was like, who lives with high BP? Like, your BP is very high. It was more than 149, it was almost 150 something. Like, anybody living with that kind of BP won't be alive, walking around, doing chores, and although I'm complaining of weakness, throw up, all those things. My dad couldn't believe, so nobody could believe. We even laughed at the man, thinking that it was a quack, like all these quacks, like, please let's leave it. So my eyes was getting bad. When we went to the general hospital, no, sorry, the health center for my site. My dad took me to the health center for my site. So as we were going the first day at Obibo, in Rivers State, there's a place called Obibo. As we were going, the road was bad. So the man called that they should just buy me some eye drops and put on my eyes. So we were doing it. I was like, it's not working. Like, I'm not seeing. I'm getting weaker every time, complaining. So my dad then took me to see the the doctor, the optician for my eyes. When we got there, they kept something in front of my eye, in front of me, that I should call the alphabet. I was like, I'm not seeing any alphabet. Everywhere is dark. They say, my dad was like, are you not seeing this thing in front of you? I said, I'm not seeing anything. That's what is in front of me that I'm not seeing. A lady close by then said that we should leave the doctor, that's how they be, that's how they do. That most time they don't know the chore and all those village and stuff. Sorry for like village, all these old women. Sorry, they're like most time they don't know their jobs. That they will give me some herbs, I will take them. My eyes will clear. The man was like, the man told us that we should go see specialists for my case. That is not longer a case that we need to
Yeah.
see specialists. So that day we went to and we were like, David, on Monday, like it was on a Saturday, we were like, on Monday we'll go see the specialist. That Sunday night, that Saturday, that Saturday, that was when the attack then started. Everything, I couldn't breathe anything. I was just practically lifeless that particular midnight, like breaking Sunday morning. The first 6 a.m., my dad had, I was sleeping in my auntie's house, my family friend's house. My dad had to rush down, taking me to the hospital. When they got to the hospital, they checked my BP. Only thing I could hear from the bed where they kept me first, for the first aid, the only thing I could hear was, how small girl like this could they get this kind of high BP? I was like, ah. When they brought it, they were like, it's almost 180 something over 170. They were both fighting each other, and I couldn't breathe. So they managed to, the nurses had to manage my case, arrest the case till the main doctor comes in. When he came in, I was like, ah, that this is a sign of kidney failure because my leg already at home was already swollen. We're thinking it's lack of blood in the body. They had to buy me all those medications, normal medications for blood, treating malaria, giving me blood, just all like that. My leg was on its own. I just felt my leg swollen, like when something's floating. That's what I felt like. I told my sister that my leg is swelling. I called my auntie. And I stayed with her practically. I was like, Mommy, my leg is swelling. She said, no, my blood is lot of blood. And when they give me blood or they'll diffuse blood in my body, that's when everything will be normal. I was like, okay. Before they rushed me to the hospital and they say it was kidney failure. I was like, kidney failure. Um, who has kidney failure by this time of the year? I was in school. I was in my final year. We were about writing our first semester exam. Because of the lockdown, we had to come back. The COVID lockdown, we had to come back home. I was like, I'm about graduating. What am I having? Which kind of kidney failure by this stage at this peak of my life now? That I'm having this kidney failure. That please, it's not me. They didn't treat me and go. But the case was getting worse. They had to, I've forgotten this thing they pipe they put in the body for urine. That was the stage I've gotten that first time. When they were putting it, me and my aunties were laughing at them like, please, we are just taking it as a joke, thinking it was just a normal thing. But the man was like, my case is something that they have to look for. They have to pay deposit of 300,000 before they attend to me. That was when we knew we were in hospital. We're like had 100,000. My family had to gather, my mom's family and my dad's family, they have to gather and create and provide the money. They took me to scan something on my chest and they were like, my BP has gotten very high. It has affected my chest, my heart. The- Uh, we were like, no problem. My family was like, no problem. Maybe it's lack of blood that is causing it, giving me hope. I stayed in the hospital for almost a month. The first hospital, sorry. I stayed there for almost a month. I stayed there and it wasn't, I called my auntie one morning. Okay, they've as in I've gone back to after them. The night I went back, I called my auntie the next day morning. I was like, Mommy, I call her mommy. I was like, Mommy, am I getting better? Because I don't see myself getting better. I see myself dying. Like I'm getting weaker. They say no, I shouldn't fear that I'm going to be okay. The next because the doctor and told the doctor everything, the doctor said they have to do dialysis, that it has gotten the stage of dialysis. Now they have to take me to UPTH, Port called teaching hospital. They have to take me to University of Teaching Hospital. That my case is getting worse by the day. They have to be done dialysis. I was like, dialysis. My aunt is what? Like dialysis. This stage. I was like, which one is dialysis again? I have no. What is dialysis? Why am I going for dialysis? That means I cannot go for it. So they were like, my family started giving me hope that it's just 2 times. That is something you just do 2 times and your kidney will come back to life. We're like, okay, fine. I was like, okay. When I got there, they checked my BP because I was actually jittery. When getting to the hospital, on our way to the hospital, they were just managing me like, you know, when you're taking someone at death point to the hospital, took me to the hospital, and actually, and when we got to the hospital, they were like, is could it be COVID? Am I coughing? My sisters, they told me, say no, you're not coughing. I manage your cough because the cough, I actually came with a serious cough, a severe cough. They say hold your cough, no matter how you want to hold it. They asked me when last did I travel. You know, this sickness, I felt it just came with a psychological issue because that time I was confused. I was answering yes, no, yes, no, yes, no. Did you travel? I said yes. When did you travel? I said 7 days ago. Meanwhile, I've been in the hospital for almost a month. So they were like, are you sure? They called the COVID board to come carry me and my siblings and my family. My dad was with us. That's when that managed brought out my medical report from the previous hospital and showed them. They were not like, it's a serious case. Can you hear me? Can you hear me? Hello? Can you hear me?
I stopped at
Yeah?
where you said,
Hello?
okay, I can hear you now.
You can hear me?
Are you there?
Hello? Yes, I'm there. Hello? Can you hear me? Okay.
So we can go on.
Okay. So when we got to the hospital, the doctors they saw my case. They were like, well, after seeing my medical report, they saw my case and they were like, it's something they need to put me in emergency room immediately. They kept me in emergency room till they had to manage my case. Then when we got to the UPT, my BP was really almost 200. They were they were scared. They were like, this guy is too young for this. They had to put me on keep me on emergency bed till like later in the night. They had to admit me, and then I was like, can't I be an adult patient? And I want to be an adult patient. I don't like the hospital environment. They said no, my case is something I have to stay. They manage my case. I don't have to step out. We kept. They admitted me. We stayed in the hospital. The fund was difficult, but God actually came to providing for me and my family to pay my this thing. The dialysis, when I went for the first dialysis, I asked the doctor, how many times are we going for this dialysis? Am I doing this dialysis? They told me just 4 times. I was like, oh, 4 times, my kidney is back to life. I was like, okay, no problem. I went because when they ran all the tests, no infection, nothing, everything was just okay. But my BP was fighting. I was having BP issues, serious BP issues. So we managed the case. Like after dialysis, the first dialysis, I mean, I went into the dialysis unit with my partial blindness. I almost ran. When my auntie told me that, I was like, I cannot stay here. Seeing people, blood, all those things. I was like, what is this I'm seeing? They didn't have to manage me. They held me and with the fear, everything, thinking I would die. Like every stage of it was fear, fear, fear. Like I was like, I'm not. I like. How would I put it? It was just God that came through for me because every stage, the first hospital I went to, the second hospital, see people sleep, wake up, the next thing will tell you, this person is dead, this person is dead. Like, how would I be sleeping? And that was putting more fear in my body. Like, People are dying every moment. You're hearing people crying. I told my dad, I told my family that me, I want to go. We stayed there over a month. How would I be in hospital for 2 months? Now, if you calculate more than 2 months, we have been in hospital. We managed, we left the hospital, came back home, and we're going for a checkup, going for dialysis. A friend of mine then called me, asked me what stage is my kidney, my this thing. And at first, I was on stage 3 kidney failure. I told him I don't know, that I don't know the stage. I was like, let it not be end stage. Oh, that end stage killed his brother. That his brother just died of end stage kidney failure. The family friend just told me too that a brother. Okay, they told me that a family friend of mine actually died of kidney. The younger brother died of kidney failure too, just of recent, before mine, like 2 months behind mine, before mine started. I was like, Jesus. I started crying that I'm going to die. My life, everything's going to be ruined. I was scared. I was actually scared, and in that scare, being scared, I was not seeing myself going every day. Any day I wake up, I didn't sleep on the bed for. Only in the hospital, I know I could lie down and sleep. But whenever we come home, I'll sit all night in the next day. I'll fix my leg on a high chair, put some pillows on top, and I will lie down. My back will pain me. There will be a table for me to just rest my head in case my neck pain me dozing off. I'll just rest my head. But some nights I will just like anyhow, if I want to die, let me just die, because I felt I would die one particular day. I just some night I'll keep my leg on the floor, waking up my leg will be swollen. I cannot stand up, do anything. They have to lift my leg up for me, keeping it on high store and tables or chairs. We we kept the challenge coming up by feeding my diet changed, no salt, this, no that, no protein. Anything protein was out of my destiny. Rice, I was like, how would I be eating rice? No stew. They were giving me white rice again. Only white rice. If they should give me the rice, no maggi, no salt, no tomato, just onions, pepper. Like the diet was just, like, why would I be eating food like this? No meat, nothing, nothing. And I love all those kind of freshy food. But they told me that everything has to stop. But we have to fight this before I'll come back and eat this. I was like, okay, fine. That if that's what will keep me alive, I'll come back to life. Fine, I'm ready to go to it. We left the hospital, UPTH. My uncle called that there's a big hospital in Port Harcourt that goes on kidney, especially it's on kidney failure. On kidney failure, we were like, okay, let's go to the hospital. We got there, they checked my case, everything, and told me that, and told me that I can actually come out of it with if only I encourage myself, that my family would do their best, but I should do mine. I was like, has it gotten the stage of me coming out of this like this? They the hospital was actually perfect. They were good. They were actually taking care of me. The nurses were kind. There were sometimes they will come in when the kids are serious like this. They'll just come in and pray for me. I was like, this one that's most one of the nurses will just sneak in and pray for me, giving me hope. It's like it's something that I might not survive. My family kept telling me that I will survive it, that people have done transplant and they are alive. My sisters were giving me hope that see this person, he has done transplant, see this person has done transplant. I'm like, people are actually doing this transplant and they're surviving. I told my sister one morning that I just wish everything would just come out from my body. They were like, okay, is that your wish? I said, yes. I just want to sleep one morning and know and feel everything has vanished, because I was kind of I will soon be 30 years. I'll not have life. I'll be sitting at home going for dialysis, crying for life. Now my life is going to be real. So they're like, my cousin actually told me no. I called my cousin that then I was crying. Told me no, I shouldn't see myself like that. I should see myself in few months bouncing back, all life and everything. I was like, are you sure that it's not as if I will leave you. One day on my own, I was using a working aid on my own. I just told my cousin that I don't if I survive, I'll be happy. But if I don't survive, I just want to sit next to God. I just want to be close to God. That every stage of my life. And my everybody seeing me was like it was a case that when they see me, they'll be like, only God that can help this girl. We went for dialysis. We keep going for dialysis 3 times a week. My session was 3 times a week. More Friday, Tuesdays, Wednesdays, and Friday. I was going like that. Tuesdays, Wednesdays, and Friday. If I'm in the hospital, I'll go. One the one faithful day during the dialysis session, I had to be on oxygen. When they called my dad that I was on oxygen, that has gotten the stage of me going into oxygen, they were like, when we actually thought she will not survive, she didn't go on oxygen. She wasn't on oxygen. They didn't fix her on oxygen. Why is she not going on oxygen? They were like, the toxics in my body is too much that it's affecting my lungs, and my lungs is getting weaker. I had to be on oxygen that first day, 4 hours oxygen. I came back home, continued oxygen. My sister then came inside the dialysis unit one day and told me that, see, it's better we go out and stay for fund. So you will leave. Say you want to leave, you want to wake up one morning and feel everything is okay. I say yes, I don't want to go on that dialysis because my back then they were actually my legs they were doing the dialysis to my legs. They were injecting the cell I've forgotten the name sorry, of what they called it into my legs. They were inserting it into my legs, and that was where I was in. That was where I was in it. And sometimes I would read though my brain would get weak. They have to carry me like a baby and keep inside the room for 1 week, 2 weeks. They'll be carrying me that same leg. They will use it. They will use that particular leg and do the dialysis, but they will keep carrying me up and down into the toilet. I was bedridden because in the house there, when I want to go to toilet, there's a bucket beside me. They will carry the bucket. I can't bend down to stool or anything, but it was difficult. Or you need anything, they'll just keep the bucket beside me. When I finish, they'll take it clean. I'm like, how would I be suffering like this? Suffering my sister, suffering people. They manage sometimes after dialysis, some few days I will be able I'll force myself and use the restroom. I we kept managing it, going out. I wasn't going out, only hospital. The hospital went to, and that day, my dad was like, this other hospital, they're actually expensive, they're good but expensive. Right now, money has gone down below what we have. They took me to another hospital, the fourth hospital. Getting there, they were giving me medication. We paid almost millions or so. They were giving me medication, other things. The day I went, I was breathless. I came back home. The first time I went there, they gave me some medication for the cough. And I came back home. I didn't even know myself till the evening. My younger sister came back from school. She actually told me when I woke up that I threw up everywhere in the house, like in the parlor there. I was like, me threw up. She said yes. I actually came in, saw what I did, went back, went outside to go and receive fresh air before she came in and cleaned everywhere, cleaned my body. I was like, me. They say yes, that they have to manage. She has to carry me and keep very well. I was like, Jesus, is that why you put my clothes? She said yes. And then I told actually I appreciate it. Thank you. You kept managing my case. One faithful day went to the hospital again. The nurses saw me and I saw some tears in her eyes. I was like, I didn't ask my uncle what happened. My uncle said nothing. That when they talked to the doctor, they said nothing is happening. That I should not be scared. That I will live. That I should just have the courage. I should wake up one morning and be praying. This sickness is not today, but to the glory of life. Even the doctor in this fourth hospital told me if I attend church. I said yes, I go to church. Asked me in the church, gave me a Bible passage to read. Like all the hospitals I'm going, they're actually giving me Bible passages, giving me hope, telling me about Christ. I was like, God, this is unto you, like you're the owner of my life. Do whatever you want to do with it. My sister came to the dialysis unit that faithful day after all these challenges. She came that day and asked me, do I want to wake up one morning and leave? I was like, yes, because they were actually suggested I should go out and look for phone. I was like, look for phone. No, now we can't do that now. People will think I'm lying. I want to steal money, all those kind of things. She said, let's give it a try. And I turned it down. Like, no, I'm not going. Yeah. Can you hear me? Hello. Can you hear me? Hello. Hello. Okay. So along the line, my sister, when she came in, and I was like, okay, I'm ready to do it. I want to survive now. She she then texted people, like we had to start looking for fun. I had to meet some of my friends, my course mates in school. My course rep then I actually sent him the listing for fun, like we are going out for fun now. Because when we went to school, I actually traveled with a friend of mine, Gold Suka. I actually traveled with her to Enugu on my school to go pack my things and drop a report that I'll be deferring my admission for some time. We went to school, we dropped it. So when they were like, Clara, can you still manage to enter the exam hall and write your first semester exam? I told them that if only I can see, I will be able to do that. But right now, I don't see clearly, and I don't know what I'll be writing there. If I can't see, I didn't study, I didn't sit for the exam. They were like, okay, we managed. They were like, okay, enter the hall and continue. Just be doing, we'll be helping you. They kept helping me for some stage. I had to go, like they postpone some exams. I had to leave. Then I had to go back with gold. We came back. We kept managing it. Herbal. My dad bought an herbal doctor, and the man came in, gave me all sorts of medications. That stage was just too scary because once you open every in the house is booming. Everybody will just leave me. When I finish, I close it and they'll come and clean it and clean up the place. So my auntie was encouraging me that I should take it. That I don't know where my medication, my help will come from, where my healings will come from. We managed. Got to, like it was so serious. We went to another herbal. Like that one, they were using some sort to massage my blood, there to massage my body. Like that one, we didn't even stay 2 days. Like massage me. Listen, it's cold that's in my lungs. That's causing the kidney failure. So I was like, no, I'm not going to do this one. This is out of it. We had to drop all the things, the mixtures, before we went back to the kidney specialist hospital, Hilton Clinics in Port Harcourt. We went back there, and the doctor said, you have to, that they advised my uncles, everybody, my dad, that we should do this. That my sister then came in, sorry. My sister then came in that time and said, okay, now see, they've said you should go ahead with it, that we have to do it. We had to start sending people. Luckily for us, not up to a month. Like 2020, it happened 2020. I managed my case in 2021, June, July. That was when people turned up for me. Like the world is so special. Like Nigerians are so the best. The world is, as in the world came up for me. Like they saw my case, they saw me, my situation. People video called everything. They're sending funds, helping me, praying for me, giving me hope. When my auntie came in, I was like, you didn't tell the family about this thing. I was like, that's my sister. They sent we should do, and we have to do it. My auntie was like, are you sure your uncle will not be angry with you? Would the family not be? Would the family be happy with you? But like, I don't know. My sister came and said, even if the family accepts it, will you still have this 10 million you put online, and the money you want is more than 10 million naira for this surgery? I was like, send it in accounts that it's the will of God. We prayed over, my auntie prayed over it, like let God take control over every situation. Only that night we just prayed. Next thing we saw was more than 500,000 into my account. That first day we put it online. My auntie was like, this is miracle. This is actually God. God wants you to live again. That God wants you to live again. Like, yes, God wants me to live. That period, Pastor Joshua, all of this man in Lagos, this doctor died. a pastor died. We're like, ah, this pastor is dead. I was like, Jesus, a pastor will just die like that. Me that is not a Christian, that is not a pastor, will I even survive? Man, because my sisters, they look at me. Are you on the same grace? Yes, same God. Are you on the same grace? We're like, I was like, no, we have different grace. They say fine. They came again a few days later that a pastor in Port Harcourt died of kidney issue. I was like, kidney issue? A pastor died of kidney issue. Ha, Jesus. One of my auntie came in and was like, you will live. That the pastor has lived his life. He has done his own for over 20 years. His son that is a medical doctor now actually gave him his kidney when the boy was younger. Giving his kidney, one of his kidney, and the boy is living, the doctor is living. I was like, can somebody live on one kidney? I said, she said yes, and then she was like, can't you remember when Dr. Carfor told us in his consultation that people live on one kidney, like 100%, 80. Sorry for using 100%, like 80 and 70% of people live on one kidney, but you will never know because the other kidney is not weak. And people live on one kidney, and people donate their kidneys, and they're still alive. Nothing is happening to them. That is something that everybody can live on one kidney. I was like, oh, that's true. Became me, she told me again, I told me that there's a young girl that died of kidney. She went for kidney transplant, but her own is in India. She did it and she died. I was like, Jesus, I'm not going in for it again. The man was like, are you normal? Not going in, and you've taken people's money. The world is coming out for you, praying for you. Everybody is coming out to support you, and you say you're not going in. That means you're going to send them the money one after the other, and you will disappoint people that came out for you. Because if classmate, primary school classmate of mine, Doris Ingiate, she actually went beyond what I could imagine. She went beyond, like, she came out for me. She came out full time. She met people, met association, organizations, met so many dignities, and people came out, like people actually came out to fight this case. So when I saw the strength people using coming out, like man was like, you want to kill these people's strength and hope, praying for you, coming out for you. I was like, no, I don't want to disappoint them. She was like, fine, you have to fight it now. Everything is in your hands now. It's no longer in their hands now. Everybody have done this. Now you have to fight for your life. Give them that hope that what they're doing is not in vain. I was like, okay, I will try my best. I kept praying. We kept praying for more funds because the hospital sent us bill, the full bill, and it was more than almost 15 million or more. We were like, Jesus, we actually asked for 10 million. Where is 5 million going to come from? And family were having some issues. When they were having the issues, my auntie would be like, see what they are writing. Another one would, because my aunties, they always follow me to the hospital. So I lost my mom. That's why I've not mentioned her name. I lost her when I was much younger. People were like, it's special attack, that they want to kill you after they've killed your mama. I was like, special attack, who wants to kill me? There's one man they brought to the house to pray for me. The man came and said, it's for my mother's side they were doing me. I just looked at it like, we should travel all the way to my mother's side. I said, my own condition, I should not be traveling to I should be traveling to another local government far from my house, very far from my dad's place. Why would I be traveling that far just because I just want to get my healing? What if I go there and that's where my death point is? I'm not taking the risk of traveling. I didn't even answer them. So my dad was like, leave them now. Right now, we have to fight this issue. We have to go online. As we're online asking for funds, we have to continue. The family are gathering theirs. We're like, I was like, okay, the family, so the family land for me. The money wasn't enough. My uncles, they brought out millions and millions and millions. People were bringing out money, millions and thousands. Now everybody was bringing out little or little. Like even the 1,000 came forth. Matter was like, even this 500 now, this small girl sent to now. Somebody sent me money. Like somebody came with 500 now. Because she was one. I was always showing her my credit alert. She was like, what is 500 that somebody came for? That means somebody is having hope that you will live and you will challenge them. You have to challenge the devil. I was like, okay, I'm coming out of it. See, that's what I want to hear. They're talking about the girl that did the transplant and she did survive. They're talking about me reading some chats and some comments on Facebook. I told them that this is not what I want now. I want to live. I told them I want to live. We go to the hospital. My family were there for me. They were fighting for me, praying for me. People were calling me for home and abroad, fighting. They were actually fighting for me. They were rooting for me. And I kept believing. I just had that courage. When I wake up in the morning, I'll be like, oh, I'm alive. Fine. It's another day to fight for it, fight to survive. A neighbor of mine of a blessed memory, one day she came into the house. She saw the way they were, I was restless. So like, this girl, she go feel live. I was like, and she said it, I got pain in my body. Like, she's saying it in my front. It's not, I don't feel, I felt weak. I wanted feeling weak that moment. She came massaging me and she was just massaging my lungs with everything. I was like, Mommy, please, I want to breathe. And actually, depression was creeping in because everybody was like, people that are taking care of me, I'm shouting on them, I'm doing this. I was like, I'm not shouting on them, that I'm trying to fight my life now. I'm trying to fight for my life now. I'm fighting, like, I'm not even trying to fight. I'm actually fighting for life now. That they should please bear with me. Whatever thing I do, whatever way action I take at that moment, they should please bear with me. I kept apologizing. We kept, everybody understood that it was a stage. It was just at that stage of my life. Then we kept fighting. Everybody kept fighting for me. When we were traveling to Abuja, we had to book my flight to Abuja. Then I've started using wheelchair. I was on wheelchairs. I don't longer walk again. I was already on wheelchair. They booked my wheelchair for me. They booked wheelchair for me. Is that I'm using walking aid to walk, or I'm wheelchair in the hospital. I don't walk on my own because of my BP. My weight was now heavier than me. I was bloated everywhere from my face down to my feet. I was bloated. They kept fighting for me. The world as a whole, the nation came out for me, fighting for me. Pastors were praying for me, calling me, oh my brother. When we got to Abuja that fateful day, I managed to rest. My auntie was beside me. She said, the flight, just close your eye and sleep. Next thing you will reach. Because I was like, as we go higher, won't my breath get, won't I, like, would I be able to breathe very well? Besides, I've been on oxygen on and off, like a faithful, like a day I was going for dialysis with some of my friends. I was like, let me go out with my friends. Now, later, since my friend was doing a PG close by the hospital, Hilton, I was like, let me just go with her. Later, my family will come and meet me up and pick me up. Or I can actually take boat back home. Because sometimes I challenge myself. I go to the hospital once in a while. They will meet me in the hospital. They will book books for me, call me back. My sisters have to go back to school. We so that fateful day, I was like, my sisters will come meet me in the hospital and go back because my dad was having his own health challenge. We're like, my auntie was going for work. Nobody could stay with me then. We managed. We went to the hospital. On our way to the hospital, we don't know what happened. Next, I became breathless. Like when I mean breathless, I was breathless. I was just breathing high. I was sweating inside the AC car, like sweating profusely inside the AC car. They were like, "This guy is cold and cold. You're sweating. You're breathing high. We had to call my renal nurse. I was already having the renal nurse number. They called him. It was like, okay, drive very fast if you can. Beat any hold up you can beat at that moment and reach the hospital. Meanwhile, just the AC, off anything AC, bring down your windows and drive as fast as you can. We got to the hospital. We managed driver and police were like stopping us on and off, like stop. They were trying to stop us. And Port Harcourt, then they were doing the bridge. Everyone was shook. We managed. God just made a way for us that it was easy for us. We got to the hospital I was immediately sent to the emergency room. I was put, like, they've already informed them that I'm coming with like a breathing issue. They were already waiting for me at the door of the gate of the hospital. The gate was already wide open for them. it was a state of emergency. As we watched it, they just immediately fixed oxygen on me, took me to the emergency room, did some things. My pulse was already down. Like my pulse was down already. They had to fix some oxygen on me, like, and then some injection on me. They were trying to get my veins, everything. Immediately, they managed to get a little vein they could get at that moment. They just put it, they actually put an injection. They gave me an injection, and this, and after some hours, I had to go into the oxygen and dialysis. After some minutes, because it was my state of emergency, they have to immediately take me to emergency dialysis unit. After some time, when I came out from the dialysis unit take like 4 or 5 hours. After the incident, they admitted me in the hospital. The doctor came in. I was like, Clara, you are a very strong girl. I was like, Dr. Fidelis, what are you saying? You're like, yes, you're a very strong girl. Hello, can you hear me? Can you hear me? You're like, Clara, you're a very strong girl. I was like, yes. I was like, with bold boldness. I was like, yes. Hello.
Continue.
Okay. I was like, yes, I'm a very strong girl.
You're very strong. I was like,
I was like, yes, I'm a very strong girl. With everybody laughed over it. And to be sincere, you're a very strong girl. That most people with normal health challenge won't make it to the hospital with the level of pulse you came in. Your pulse level was over 40 something. I was like, I don't know anything like medical this. I was like, thank God. My sisters, they looked at me like, it's God. We all said it's God at the same time. The man laughed because we were actually making the holiday, like we're friendly with the doctors. All of us just say it's God. They then laughed and say, yes, it's God. We went home a few days later. I was discharged a few days later. I went home, and that was where we arranged for Abuja and my transplant. The money was almost there for us to get for the transplant. When we got to Abuja the next day, we managed. I was so uncomfortable. Take me to this ward, take me to this doctor in and out. When we went to see the transplant consultant, when my auntie left, I told the porter to wait. I then asked the doctor. I was like, I'm sorry. I asked the doctor. I secretly asked the doctor, is there any way I can get healed without doing this transplant? She was like, no, Clyde, there's no way you can get healed. Don't be scared. Transplant is not a hard thing. 80% of them you see here, they're having some issues. Some of them have actually done the transplant. They came for the checkup. I was like, okay, I'll do it. So that night we had to see the MD of the hospital, the main consultant and transplant consultant. We saw him, and it was like, have I done dialysis before? I said yes. How many times? I was like, I can't remember. Like I did like almost. I was like, it's almost my life, a life thing now. Like I will live on dialysis practically now. And they were like, okay, that I have to do dialysis. They went to the this and prescribe some drugs for my auntie to buy some histamine and other things for my immune system to boost my blood and other things. Okay, went on the dialysis machine again. It started. I was actually jetting inside under the machine. I was like, I cannot breathe. I need oxygen. I was jetting. They got me hot water like in 2 packs. With blanket duvet. They got me like almost 2 duvet with hot water to massage my body, because that's what they do in Port Harcourt, in the hospital, Hilton Hospital in Port Harcourt. They give me blanket and hot water with some injection iron and other things to assist to help me. So we kept managing. So when I called and called and called, nobody was. They were answering me, but they were like, what was on? What was on? When I had to ring the alarm, when I was ringing the alarm, my auntie moved in. There, when she came in, The last thing I could remember telling her was that I'm not going to die. I was just confused at that stage, in that Abuja stage. I was confused. I don't know what was going on. I was asking for oxygen. Next thing I will remove the oxygen. Next thing they will wear me I will request for oxygen. I don't know what went on along the line. My auntie was just like, you're a son girl. Next thing I woke up the next day, it was in midnight, they tapped me. I saw myself in emergency room. I was like, oh, finish your mind. This is my emergency room. They were, when I found out, like, they tapped me to take some medication, and so many things were on my body. Like, I don't know how to call them. They were putting so many machines on my body. So many machines were already all over me. And I saw it. I was still unconscious of myself. They just gave me some drugs, medication. They tapped me and gave me some medication. I took the medication and I slept off. I woke up the next day. Was it was in the evening times? And then I don't even know what happened. When I woke up, I practically smelling. I then told my sister, I woke up, the nurses there came to call my sister. My sister went in, immediately was calling my auntie that I've woken up, I've woken up. I was like, woken up? I don't know what is going on. They told me, my auntie told me that you died yesterday and you came back. I was like, die. I was like, how would I die? How would somebody die? Because they were like, the only word they could use was like, cry, you died and you came back alive. That was the only word they can use to describe what happened to me yesterday. That when the dialysis, they actually took them out of asked them to leave the dialysis and unit, told them to step out from the dialysis unit before they took me to emergency room. When they took me to emergency room, they were actually they say they used something to inject me back to life. Like, I don't know the name of those things. They use injecting me back to life. I mean, I don't know anything. They're like, how would you know when you were fighting for your life then? I was like, oh, thank God, Auntie prayed over me that since I've come out of it, that I will never have any challenge again. And I was admitted to the hospital. I was placed on oxygen 24/7. Like, I was living on oxygen and dialysis. I don't step out to ease myself. Maybe if I'm stepping out of just something of how many seconds, the nurses will be angry that I shouldn't step out. I should just come down. They should get me a bucket. I should stay and ease myself. Like this. This is not a private ward, but I can manage myself. I will not die. That was only time I could manage myself was when I would go to the restroom. I started seeing myself standing up on my own, going to the restroom. I started going to the restroom to ease myself. When I come back, immediately they are putting me on oxygen. I sleep on oxygen, go to dialysis on oxygen. Even when I'm eating oxygen on my nose, I was living on oxygen and dialysis with my medication. Doctors came in, checked and said nothing. They were like, nothing is wrong with your heart, your chest. Yes, but your lungs, they need to, we kept doing, they actually asked the physiotherapy and therapists to take care of me, to massage my ribs. They kept massaging my ribs, so nice oxygen. I made some friends that have done transplant before, and they told me that it's a matter of life, that I shouldn't be scared. That she again met me that I shouldn't be scared, that she has done transplant, and it's at 5 years of doing transplant. I was like, 5 years? That one stage that I heard that end-stage kidney transplant patients, they don't survive we don't survive it because they've already informed me that it's already on end stage. She told me, she laughed and told me that her own case was also end stage. That before they flew her to India, before she went to India to do her own transplant, that who told me that end stage patients, they don't survive. And a friend told me that his brother died on end stage, that end stage people don't survive. She then laughed and said people survive end stage, depending on your grades. She just told me depending on your grades. I said, no, I shouldn't be scared because I wasn't like, I'm not going to do it again. No, that's going to take the whole day to tear my body. She's like, that thing is not up to 4 hours. You're in and out of it. After I got my I was more encouraged. When we got to the hospital, when they bought up my hospital bill for the first month, was reading 1 point something million. My auntie started crying that where is money going to come from? That's right now that 10 million is not going to go anywhere for me. My cross-matching test was 1 point something million. We bringing in, we looking for donor, all those things. It was so challenging. Then we had to fight for it because my family, my we found out that BP, hypertension, was one of the major cause of it, and it could be genetic. We had to. We're not like my siblings. My younger ones are still minors. They cannot go in. My dad was sick, and the BP now was the donor now was our major challenge. Before we actually solicited that anybody will help us, we looked and looked for. We're fighting for donor. Donor was the major challenge, one of the major challenge. We stayed and looked for donor. Oh, like half of from July from when we started looking for fund, asking for fund. That's when we started going in. My siblings started going in for matching test. Actually, it was matching, but they were still donor and they were still minors. We don't know what to do. Like my dad is having his own health challenge at that point. We kept praying that God would bring it somebody that will volunteer, want to help. Even if he requests for funding, well, on his own, he will come out and ask for it. We prayed and prayed. We prayed over the donor issues. We we prayed. My auntie fasted for it. My friends were encouraging me that don't worry, donor will come on his own. A perfect time when God wants me to do this transplant, that's when the donor will just match in. When we were like, okay, but so we're still like fighting, looking for donor, if we could get it in any way. They were like, no, we can't go anywhere illegal because what we are going for is a matter of life, and we don't want to take any way because me, I was like, mommy, we should always look for somebody now, those any other person. My brother should, even if we like that my brother's age is more than that, we would always do it that I'm getting weak. He said, no. Because even when we went, I was not when we went to meet this the surgeon consultant for the transplant. He told me, "Don't be scared. You will go." That most people working in this hospital with their legs not on oxygen, not on anything, they are actually transplant patients, and they're actually coming in to book for the transplant. That I should encourage myself and other things. We kept doing it. We kept being on. I was on oxygen, going on and off, fighting for life because they said I can't do this without me, without um while I'm on oxygen. I have to stand, I have to be healthy, I have to work on my own, do so many things on my own, show that I have strength for it. I was like, okay, it's a major challenge now. We started, I started fighting, helping myself. Most times I would challenge myself, take off the oxygen when nobody is around. I'll just take it off. When I notice somebody is coming out, I'll take it. We kept doing that. I kept praying and I say fasting. I kept praying, putting worship songs. I just kept living my life on God because at that point in my life, I felt it was God, only God that can help
I can
me.
imagine.
Yes, like
And you're a strong woman.
thank you, it's only God. When I did a
Wow.
surgery on my neck, a neck surgery, like this thing for dialysis, even the doctors were like, this guy is she's not even shouting. That old man that came previously, he was shouting. I could hear them saying it, but at that point I was like, I just want to leave that place. I just want to leave that theater. I did my next surgery in Port Harcourt. We kept we kept fighting all those things where it was a challenge. My sisters were going to school, flying in and out of Abuja, to and fro Port Harcourt. My auntie was working because my auntie is a supervisor in the education board. She was senior supervisor. She was always in and out flying. My cousins were coming in. Nobody was stable because everybody have their life to live, and I was practically holding some people down in their life. It was something. I was like, oh God, please, I'm holding people down. Whatever I want to do, please just be doing it fast. We had to employ somebody. I had to employ a caregiver for me. And she came in. She was taking care of my auntie. We were staying my auntie's house in Abuja. My auntie was helping, praying, encouraging me, telling me about her friends that did surgery 15 years ago, 20 years ago. Like, I was like, people are doing surgery years ago. And somebody told me after 5 years, my kidney will fail. I'm like, what is happening? And all these things were discouraging me when I was in side talks, all those things. One of my major challenges, I was hearing side talks, you die. After 5 years, your kidney will fail. After 2 years, some people after 2 years, their kidneys will fail. Like, I saw some, I went to the hospital, I saw people 10 years ago, and they came for their checkup. All like this was, I've done my few years back. Like, Clara, you can do. I took that challenge. Like, Clara, you can do this. I kept meeting people, asking questions. We kept finding out different health challenge, like different symptoms of this thing. Majorly I found out was diabetes. People having diabetes, high level, and like the diabetes affect the kidney, BP, infections, different people, different. Mine, I felt it was BP that caused mine because they asked me if I have any family member that has BP issue. We said yes, my dad has BP issue. They were like, oh, and they asked me, didn't I take care of it? Didn't I was like, how will I know that I have BP issue? I'm not this hospital kind of person. I don't go to the hospital except maybe I'll be sick. And they were like, are you not always falling sick frequently? I say yes, I used to fall sick frequently and I'll go for checkup or maybe I'll buy drugs and take and I'll get myself like I was being careless with my health. Yeah, I was like they were like yeah, I was being careless with my health. That's why that BP I'm having serious BP issue and other health challenge which was normal which I felt it was not the major challenge. It was peptic ulcer. I was also having peptic ulcer because I couldn't walk straight. Everything I was bending down to walk. I was having burn on my chest. That we didn't feel that was the major. Was I don't even feel it now. That was one of the major. I just felt it was BP, hypertension that caused my because in school we walk under sun. You walk to school. You come back, and when I'll be having a headache. I'll say maybe I just need to rest. I'll rest. I will take water. I was finding I don't actually like taking water back then. No, until after I had this sickness, water became my juice. Water became everything. I don't want to. I don't live without my water. Whenever I'm going, they'll be like, "Oh, you're with your signboard." I was like, "Yes, this is my best friend now. My water is my best friend." School then maybe after the stress everything I'll just go look for food and want juice or take juice, take cook all these soda drinks, take it. When I take it finish, I'll sleep. My little cousins, they will call me, they'll be singing for me, they'll be praying, coming around the hospital, those kind of things. It was a challenge for me. My cousins, when they'll come in, they'll be crying. Some of them will, the emotional ones, they'll be crying. They'll be like, you, they'll be like, are you going to survive? Actually, children, they'll be like, are you going to survive this? I'll say, yes, I'll survive. You will come for my wedding. They'll be like, please, I can't wait to come for your wedding. I'll laugh over it. When you do finish, you marry. I'll say, yes, I'll marry you. You want my little niece. I'll say, not that your little niece will just be joking. They'll be like, okay, you. I say, no, I'm not going to marry you. I'll take it outside the country. Next year, I was just giving them like hopes, like I'm going to survive. Even if at that point I was seeing myself dying, I will give them hope because I had people giving me hope. Then the emotional ones who come in, I'll be like, okay, no, don't worry. When a few years from now we'll go to Dubai and have fun. They'll be like, please, I can't wait for that. Whenever when I was in Abuja, they will call me, are we still going to Dubai to have fun? I'll say yes, start saving your money, because now I'll start saving mine. They will laugh, we kept cracking jokes, they'll call me like because then they call me my native name, Ibilate. They'll be like, Ibilate, where are you? Are you in Abuja? Yes. it's not where they're bombing. I'm like, no, they're not bombing. Yeah, I'm okay. Yeah, you're like, they'll be like, okay, I just want you to be fine. Yeah, I said, okay, I'm fine. Don't worry, I'm fine. Why, who is crying behind? I'll be like, it's the younger sister that is crying. They say she's crying that I will not, that she wants to see me, she wants to come back, and she wants me to come back home and stay with them. I said, okay, I'm coming. That they should, I'm coming in next week. I'll come in. They'll go like, are you not see coming next week? I was scared that am I going to survive? Am I going to promise people I'm coming back and I won't come back? Be my cousins will be like, what are you saying? We finally found a donor, we paid the donor, and donor came in. When he came in, it was like, when is transplant taking place? We say we don't know, we have to run some tests and other things, and I have to be stable. I have to be stable there. It was like, okay, that he wants to go back. We are like, go back where? You're not going anywhere. You're going to stay in this Abuja with us. We will not, even if for us to rent a house for you, because you can't stay in a family house where I'm staying. We are going to rent a house or lodge somewhere for you to stay. See, whenever my transplant is taking place, he said you have something to do. We are like, how much is it he's going to give you? Please, who will you that? I will please stay. The boy came in, I saw, and actually had passion on me, like, this guy is suffering through this thing. Let me stay. Even if they're paying me, I'm coming in.
Yeah.
And he was mature, he was up to the age, he was the one that gave his consent of everything, Even if he's going to take something which is minor from us, but he just felt it was just God all the way. It was just God. We kept we kept like we kept posting him as this next week I did the transplant. It was like, okay, no problem. We'll call him, we'll be like, he wants to go, he has something to do. We said, no, don't worry, you will not go, please. He said he wants that his phone is missing, that he needs to be communicating with his family people. We got him a new phone. We got him a phone that we registered him for him. We say, okay, do you want an account where we'll put the money? He said, yes. We just know when you're carrying somebody that at the point came out for you. My auntie will be like, whatever you want, you just say it. I will give it to you. Wherever you want to stay in Abuja, just be safe. We'll give it to you. We're feeding everything. We are handling everything for you in Abuja here. Everything was just challenging. If foundation came out like they were like, how are we going to come out to tell these people we need money? Because money in the hospital has finished and money in our hand has finished. The donor has come. Everybody is here now. Like it was almost time for they started running the test again. We started running the test again all over for him and for me. So if foundation came in, asked my auntie to send the hospital details for the transplant, and they deposited they paid for practically everything again. Like they paid everything, like the money completed, it was complete. Another person's paid another money again for my drugs. Because actually after the transfer you stay on lifeline drugs, paid again. Auntie just came in, I was like, you're indeed a child of grace. That is only God that is doing this thing for you. That is only you that you have to fight for your life. Now that everybody has come out for you, the world has come out for you. On no foundation, disturb us, brought protocols, and paid for your medical bills all over again. Because after this time, we were thinking of letting the guy go, we coming back to Port Harcourt and solicit for fund again. Before the foundation and came in and paid for everything. We 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 kept like going for doctor's appointment, we kept doing dialysis, we kept on and on. The one faithful after dialysis, my sister came in that my transplant is the next day. I was like, how would I just dialysis and go in for transplant? I told a friend of my Quakers, she was one of the engineers in the hospital, in the renal unit. I told Quaker that I'm going in for my transplant tomorrow. I was even happy. It was like going in for your transplant without doing plasmatics, without doing all this thing. I was like, people go in. Probably got like, okay, they booked me already. I went to the country to eat. They were saying, they are tired for the transplant. That the next day, another person is coming in for the transplant. I'm the one they were actually talking. They said they were actually tired, and the doctor, the chief surgeon is going to India the next day. I'm like, whatever it is, and he kept. I was like, okay, fine. I just overheard them. I was like, let me go into my room. They've already admitted me into the hospital. I actually thought my room was the first room I was when I was sick of renal. Listen, when I got there, I was not gisting with my friends on sick bed. I made friends actually. I was gisting with them, talking. They were like, tomorrow is your transplant. Wow, wow, wow. They were happy for me. Congratulations, congratulations. I was like, yes, thank you, thank you. Manage. Not staying in. I said, do you want to actually do your transplant tomorrow? And you're coming in to stay the with the ones that are sick. Don't know they will infect and you won't be able to do your transplant. I was like, oh, sorry. I was like, oh, sorry. I went to they then showed me my room, a private ward. I was I was there. The next day, I was sleeping. My friends were calling me, Claire, you're going in for your transplant. They were praying for me. I was a bit scared, but I kept believing God. My aunties, I called everybody, they informed everybody about my transplant. We kept believing God. We kept, everybody kept calling, praying for me. We were like, oh, me, I was so happy that, oh, after tomorrow, I'm going to be free from it. They came in at the next day, 12 o'clock. I've not seen anybody. They've not come to change me. They've not sent in the theater clothes. Nothing, nothing. I was just there. I slept because they told me not to eat till 2 o'clock. I was like, I'm hungry. It is past 2. Are we still doing the surgery? 2 o'clock, 4 o'clock. My sister then said, you have to eat because my brother started jetting for food. I was like, I'm self-achieving. I mean, I want to eat too because I actually love food. All the nurses and doctors, they know me for that. Whenever they come for for world run, they always see food on my front. They'll be like, madam, you're doing it again. I'll be like, yes. And then when my sister brought in food for me, my sister said, you have to take something. My sister made tea for me to drink because I stopped drinking Milo milk all this. I was taking lip tea, unsweetened food, all this, anything that is not sweet. My sister had to do my lip tea for me. I took it first. I actually took the lip tea so I could wait for anything that will come up. We waited for most few hours. They actually before they came in and told me that I have to go home. Now my surgery has been scheduled to the next month, which is October. We're like, okay. I told my friends, I told the donor that he has to go home that next month, next 2 weeks, which is next 2 weeks, that he has to go back to this hotel room. We'll pay for him to stay in for the next 2 weeks before we come back. We'll do the surgery. It was like, okay, no problem. He was just being cool. He wasn't having any issue. We're not having any challenge with him. Whatever we tell him to do, no, okay, we'll be like, Monday, please can you come to the hospital now? Next 5 minutes or 10 minutes is there for us. He was not having anything, he was just being cool with us, quiet. He was times he will even hold my hand and be like, you survive, yeah? I'll just be nodding my head. Like, yes, he was like, you survive, yeah? I'll nod my head, I'll say yes. Be like, okay, we'll continue again. We'll go for surgery. Like every time you hold my hand, my caregiver was she said every night that she wakes up, go to the visitor's parlor and pray over me because the way I was breathing, like somebody that will not leave, that will not wake up the next day. I was breathing very high when I'm sleeping. I wasn't sleeping normal, like every normal human being sleep to like waking up. I was living like a dead, like partial dead. What, like what should you like? You're living like a partial dead person, like somebody that will not survive the next minute. That was how I was breathing. I was sleeping. Everything around me. She was cleaning me up. She stopped me from bathing. She'll be if I want to enter the bathroom to bathe, she'll be like, no, 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 no. She would be the one to clean me every moment. Every moment, I felt she was just pressing me. Every moment, are you okay? Every moment, like every seconds, are you okay? Do you want anything? Are you fine? Even when I ask her, I'll be like, Auntie, please go and get me something, some fruits in the. I need some fruit. She'll be calling me on her way. Are you okay? I'll be like, yes, I'm okay. Everybody, like, it was something that she was, according to her, she was like, she was scared every seconds for my life. I wish I could, like, I've lost so many of my pictures. I deleted so many of those pictures of me when the my sisters, most nights my sisters, they will carry me. Sometimes my sisters, they will carry me. They'll be like, come out. They'll take me out. But I was depressed. I was always on my own inside the room. I don't come out to the parlor because according to me, then I was like, I'm looking like an aged woman. No hairs any longer. My front hairs are gone. My hairs are already. I've lost so many hairs. The, the peps, that was how I was challenging myself. My sisters will bring me out. They'll take me out. They'll comb my hair. They'll be like, I can't walk. They'll be the one to hold me to side, all in the name of style, do videos, making me feel like I'm alive, that I'm still living. I shouldn't feel dead when I'm not dead, and I'm not going to die anytime soon. We kept fighting. So on 19th of October, that was when I went in. Well, I went in for my surgery. The day for my surgery, I called my friend Doris. I called my friend, she called me. I was like, what time am I going in for the surgery? I told her, I told my auntie, I told everybody. They called, they prayed for me. My friend I met in the hospital to a family friend. She came in, she was like, Clara, you're a strong girl, you will survive it. That although people that yes, people don't survive it, but some people don't. I should not take the fact that it's few people that don't survive, many people survive, comes out of it. I'm like, okay, yes. That okay, I should see a boy of the boy should be 12 years or so, a 10-year-old child that has done this transplant. I should see this small boy. A baby just did this transplant, has done this transplant, and is living. See him fat and chubby. I was like, okay, that I will survive. She told me, okay, see, Kings. Kings has done transplant before. He's a small boy. That boy should not be up to 12 years or 13, that I will survive it. That people born with, that most people, that there's a boy that they gave birth to him with kidney transplant issue. That his boy is alive. I will survive. I say yes, I'm going to survive. That many people survive. That it's just a matter of how many 2 hours I'm done. Like 4 hours at most, I'm done. A romantic called and prayed for me. We prayed. I then went in for the surgery. Even when I was in for the surgery, I was jetting, I was scared. And I was taking this injection they do give at the spinal cord for it. Before I went in, I called a friend. She said I should just say a word of prayer. I should just tell God that I'm giving him my life to hold. When it's time, he should give me back. When it's the time for him to give me back my life, he should give me back. I was like, okay, I'm going in. She then said, yes, strong girl. Everybody in the house, they're calling me miracle girl. You're calling me. They're just giving me strong woman, wonder woman. They're just giving me like names like miracle baby,
Like,
favored girl.
right
Yeah,
there,
they're just,
like,
yeah, that you're still alive, that vibes. Yes, most times they'll just play music, they'll call me to dance. This TikTok video, they'll want to put me among me. I was like, okay, let me flow with them as they're being happy with me. Although I'm scared, but as they're celebrating me living every day, I should follow them and celebrate myself. I went in for the surgery. Not long, I even came out. When I came out, safe, I saw myself shaking my caregiver. I was in my caregiver, like high five. Then everybody was like, did you just do a surgery? Like, is this one that did surgery many minutes ago? I went into the HDU and my mouth was just everywhere running. They were like, Clara, you need rest. I say, yes, I need rest. They should bring my test source for me. That's when I'm going to rest. My caregiver had to go in because the test source I took into the hospital wasn't what the hospital needed. So in the hospital there, they sell in test source the ones they need. They went in with my small leg. It was not difficult for them to get small size. We got the size. We kept everything just kept going on and on. Finish. That day was over. The next person they brought was the pastor. The next morning, that was when I started feeling pains, like severe pains. So I was in the next morning. I think the doctor, the surgeon, sir, I'm feeling pains. Yeah, like they say yes, it's a pipe to take out all the toxins in your body. After the surgery, all the waste out of your body. I was like, okay, fine. I was like, okay, but it's paining me. I don't feel comfortable. There's like, take your mind off and you feel comfortable. I I was like, okay, fine. I took and I still feel pains. Like I still feel pains. I the next person close to me, Pastor Jude, he also did this transplant the same day with my Pastor Jude was just a vibe on his own. Like you will just know that I was like, this man is not scared that okay. When I came in, I was feeling yes, I just did the transplant, thinking everything. I was like I started feeling pains. He wasn't feeling pains. The next day, 12 o'clock, I'm not eating. Pastor Jude just stopped and called the one of the nurses there. That him is hungry. That him is hungry. He wants to eat. I was like, is it time for us to eat? When he asked me, have you eaten? I said, no, since yesterday, I have not eaten. I'm not eating that. I'm yesterday I wasn't even feeling that I needed food because I was not on my normal body, normal self. Pastor Jude was like, okay, I'm hungry. Please they came in before me. Get us something. They got us our normal lifting, just hot lifting. We took it, and that alone, we're just taking, just lifting. I told the man, this part of Pastor Jude again. Pastor Jude, I'm still feeling pain, so I'm still feeling pain where I did my surgery. The pain is becoming severe, like I'm getting weak. Pastor Jude then held my hand and prayed for me that morning that I'm not going to die, that I will fulfill my life on earth, my destiny, that nothing's going to do me. We kept we kept asking like, are you okay? Kept like checking up on me. The nurses were checking up on me. The surgeon was like, we've given you everything you need not to feel pains. And if you continue feeling pains, we'll call in a specialist from India to come check you. We'll call in a specialist. But so like, Pastor J was like, this specialist they're calling for you from India and you're going to pay like 1 point something million for only the consultation. I was like, Jesus. He just whispered to me, which we don't know the exact amount, whether it's true or not. Maybe just wanted giving me that courage. Like, I was like, Jesus, 1 point something million. When we are looking for money for my health now. I'm like, no. I'm no longer feeling pains again. As I just said, I'm no longer feeling pains. I kept managing myself. I can't pay 1 point something million just as I heard that amount, like, we need that money, that if that money should come to me, it will go a very long way for me on my health challenge now. We then laughed over it. He then held my hand and prayed over it. The doctors came in, they checked, they did some adjustment in my medication. I slept and slept. I was not giving issue. Few days into this thing, I started having my BP started rising again. They gave me this medication, labetalol. They gave me labetalol. I mean, like two different kinds. They were giving me, and I'm not having that BP coming up and staying like that, being like stagnant like that. They have to give me my labetalol. They've done it. It has happened like two different occasions. They have to take me to emergency room. They told me that they're taking me back to emergency room if my BP doesn't come down and it's night, so I will sleep over at emergency room. I'll be like, no, please, I want to go home and go and sleep. Or just want to close your eyes. Next thing, your BP will come down. She will pray for me and tell me close your eyes, your BP will come down. That one finish. Another one again, it was my caregiver that was with me. That was my cousin. I was jittering. They have to take me to emergency, give me some injection and medication, tell me to go. I told them I'm not going anywhere. I don't want to die in my house. I want to let me stay here and die for them. Give me something of emergency. They will attend to me. I remember how they told me to overcome it. They told me just smile to me, pray over it, keep your head down, and rest. Calm your mind. Take a deep breath, take a effort and rest. Just calm your mind. I did that. Few hours later, my doctor consultant came in, Dr. Fakole came in, and so what is wrong with her? They say labetalon. I didn't want to overfeel that with labetalon that they should prescribe minodazole for me and prescribe minodazole for me, and immediately they brought in the minodazole drugs. It's a BP drugs actually. They brought it in. We continued. We continued, and everything went. The better everything went down. Because the nurses were like, Clara, you don't have issue. You're always sleeping. It's not you're sleeping, you're eating, or you just watch movie. You were not having any challenge. You've gone on back on oxygen. I went back on oxygen. They were like, Clara, you're going back on oxygen again. The cardiologist came and was like, is it again? I was like, no, God forbid, it's not again. I'm going out of it. I'm just few hours from now because I and my donor were placed on oxygen. Like again, we're like, no, we'll come out of it in a matter of few minutes. We'll come out from it. He laughed, everybody laughed. I just said this with boldness, that courage. I just gave myself courage. I said it with all boldness that I'm going to come out of it, this oxygen again. I'm not going back to my oxygen again. I can't stay on oxygen for years, I'd say years, for months again. I was like, I was so scared. That oxygen part was also scary for me. We laughed over it and we left it. I came out of the oxygen. God helping me. I came out of the oxygen 2 days after everything. The BP came down. And in among everybody, some people they were taking some people to ICU. I was saying that I'll wake up or they'll say that I've taken so and so person to ICU, they're taking this person to go and do plasmapheresis again. They were saying, somebody was having, like, was throwing up, somebody was reacting to the oxygen surgery. Everybody thought that man won't survive. But God, we all God being everybody's side in the HGU. The man, we actually thought the man will survive. We are actually rooting for the man to live. We also patient, but we are praying for that man to survive. Everybody, they told me that, Clara, you're leaving the HGU to the world today. I was like, me. I was like, oh, thank God. I started cleaning myself inside the room. I was using my hand. I was not the one cleaning myself, going to the toilet to clean myself. I started walking to the toilet by myself. I started like doing things by myself, standing up, eating. One day I was sleeping. I was like, how would I keep my bag like this for almost a week now? I've kept my bag. And I shifted my bag like to move my body upward. I never knew I was bleeding from some part of my body, and they had to call the consultant for this. Is it what they call this injection they keep at the back? They inject at the back. They had to call the consultant that I'm bleeding from behind. I mean, I told them that please, something is like I'm feeling sweat, like I'm sweating from on my back. They should please clean my back. When they got the sweat, they were like, you're bleeding from your back. I was like, I'm bleeding. The man, they immediately called in like those. They took it like a matter of seriousness, like it's a serious issue. Like I'm bleeding. I was like, I'm bleeding. Okay. I was just living a carefree. I was being careful. I was not being careless. I was just living like I should put all those things in mind that I've already come out of it. I'm out of it already. I should not see myself out of it. And my friends, family, everybody was praying, rooting for me, calling,
I want to
texting.
ask you, Clara, are you there?
Yeah, I
So I
am
want to
here.
ask, how is your donor now? How is he?
we speak very well. It's fine. He's living his life.
Yeah.
Yeah.
So how do you feel like? Do you feel different from the way you were feeling before the surgery?
When I was sick, yes, like
No,
I feel
I
like
mean like your life before the whole sickness came up and your life now. Is there
yeah,
any difference? Like,
yeah, like I feel more energetic right now. Like I could do so many things. I would not see myself doing so many things that I can't do before I was even sick. Like like a new body, like a new strength, a new hope. Everything was it's just new. Like a new being. Yeah.
so are there persons? Because you've been mentioning some persons, and sincerely, people say that it's when you're in trouble, you know you actually have people. You know you have a family. You know you have friends. You know the world is out for you. Like the world is there to support you. So are there
Yeah.
persons that actually stood with you during this time that you would want to, from the depth of your heart, you want to tell this person, wow, God actually used or placed this person in my life to stand by me during these trying times, and I'm super, super grateful to this person. So I
Yeah,
would like
that's
to know, maybe your family, you can say, okay, your family, but I really want you to appreciate them specifically on this live stream.
okay. Should I mention the names? What if they don't
Yes.
want the names to be mentioned?
Okay, even if you don't want to mention their name, my friend, my family. So I really want you to say how you feel to them.
Okay, like if I start mentioning it, I'm mentioning everybody I know in this world. Like
No.
I
All
just want to
right.
take
So
this
can you
whole
just
day.
rounding up in three? Okay, let me say three categories of person. Yeah. Your family can
Everybody,
be one.
my
Your
family, my
family can be
friends,
one.
my classmates, my secondary school classmates, everybody, like
Everybody.
most strangers,
Right.
like strangers too. Like I'm going to mention all everybody in this world, even people I
Wow.
don't know. Yeah.
Wow. I really feel happy for you, and sincerely, you're a strong woman by God's grace, and we're glad you're. Your world is glad you're alive. And you living life now, you're living life to the fact that God actually kept me alive. People stood by me to make sure I'm alive. The world, like Nigerians, people outside, even everybody who stood by you just to make sure you're alive to achieve your purpose, chase those big dreams, and hit it very hard. So I would want to know, do you have anything to say to our audience, encouragement, especially to those diagnosed of kidney disease? You mentioned specifically how when you were in the hospital, someone told you that, see, I've stayed with this, I've done this years back, this is years after I've done this. So I want you to also encourage someone.
Yeah, okay. I would like to encourage those mostly with kidney issue, even everyone, to just don't give up on yourself first. It's yourself that matters. Don't just give up on yourself. Be able to filter out some things you hear about this sickness. Because when I was doing this dialysis, they told me that after dialysis, you are not going to work again. I was like, work? Ha! You see me now, I'm jumping, so even sometimes I will move on to jump. I will jump, but now I'm back where I did. Like, I was skinnier than this before. I was very slim. Those things, you don't know they used to call me. My sisters will be like, this neck bone, we need it and fresh water. I was a very skinny person. Like we always laugh ourselves like a funny joke. We crack these jokes. But now I'm always everywhere. I'm even fighting for. They'll be like, "Why are you fighting for food now? You're not supposed to eat this thing." I'll be like, when the doctor said I shouldn't eat it because I'm placed on diet. I'll be like, "Well, when the doctor said I shouldn't eat this one, when the doctor said I shouldn't eat, I respect myself and I don't eat." I'll be like, "Okay, no. Doctor said I should eat this particular." I gave myself that hope. I
Yes.
I just encourage myself. I kept believing God because God is number one. When you believe God first before you believe in yourself, and you'll be able to filter out when God is by your side. You will be able to filter out even Muslim, you don't believe in your Allah, whatever religion you don't believe in whatsoever you're worshiping. and you'll be able to filter out. There'll be more courage. Just believe in whatever you worship in. Just keep praying and for yourself, your family. Just give yourself that courage. Just be bold. Just be able to say no to some certain things. Because after my surgery, I was not like before I went in for my surgery. I was like, I told my caregiver that I want to cook before I go in for surgery, which is the next. I'm going to the hospital for admission. The next day, she was like, cook. No, no, she cannot. I was like, I'm going to cook this food. Arrange this food for arrange the things for me. I will enter the kitchen. I will cook by myself. She was like, are you sure? I say yes. And even in Port Harcourt, sometimes I'll tell my auntie, let her go for a walk because most times she travel for work outside for works for exams. So I'll be like, okay, go in. I will I will be there to be like she cannot cook and travel all those things. I'll be like, okay, let them buy the things and keep arrange the things. I will cook, I will do I challenge myself.
Wow.
Not be able to challenge yourself, give yourself that hope, that life. Just be bold, just take that courage. It's a matter of faith. Otherwise, all I have to say is like if it's like
Thank
faith.
you very much, my Clara. Like,
Thank you.
you don't know how much you've done. You are a strong person, and we are grateful to your family, your friends, the world entirely,
Thank you, God.
everyone that encouraged you, helped financially, the donor, the doctor, the nurses coming to pray for you. Ah, man, that's high favor. Like you could see the love on everybody's eyes that people really
Yeah.
want to see you come out of this strong. And I'm happy we're having this interview session with you today. You've said a lot, and I could see the joy on your face. Like this person is alive and grateful for this life that were some persons are even careless about, and you don't know what the family they've gone through to make sure this lady is alive, what she has gone through, how God has been there for her, and medically too, how the health practitioners actually stood by you all through this period. We're giving God all the glory, and we
Yeah.
appreciate God's life. And this will go out there to encourage people over and over. This is social media. It will always be here, and you too will always be here. So on behalf of Victoria Oya Health Foundation, welcome back to life, and we love you and want to see you hitting those big dreams alive. Thank you for
And
being on this live with us, and we'll come to the end of this interview. We hope to see more of you. Maybe sometime have a talk about how someone who was once a kidney transplant patient is now a big woman. Like, very big woman. This is someone that died and woke up. Yes, someone they said you died, oh, and you woke up. But she's here alive with everyone. We're all alive to glorify God and to thank God for your life. Live those
thank
dreams.
you.
We celebrate you. Thank you once again. Bye.
Thank you. Yeah, bye. Yeah, thank you. Bye.
Bye.
Bye.